You may think that routine checkups are safe, harmless, and necessary. But what if the next one does not help you, but instead hurts you? Every day, seniors over 70 are screened for conditions they do not even need to worry about. The result is a 300% spike in overdiagnosis, a 60% jump in false alarms, and thousands of older adults ending up on medication, under the knife, or in hospitals for problems that did not need fixing. Here is the terrifying truth. 99% of seniors are still receiving these tests, even though top medical experts advise against them. One of these tests has a 40% complication rate, does not help you live longer, and may actually increase your risk of death by 21%, all for a condition that did not need treatment in the first place. This video exposes the 5 checkups that seniors must rethink after the age of 70, ranked from least to most harmful. You will learn which tests to question, what risks they carry, and what smarter options experts now recommend. This is not about fear. It is about empowerment through science, and every reference is linked in the description below. Before we dive in, have you ever had a test and later wondered if you even needed it? Let us know in the comments. We are reading and replying to everyone. Now, without any further delay, let's begin with the first test on our list. It sounds routine, but it could quietly start a chain reaction that ends in unnecessary treatment and lasting damage. Number 5 on our list is routine bone density scans, also known as DEXA scans. Osteoporosis is a serious condition that can lead to falls, fractures, and a loss of mobility. That is why bone scans are recommended for many adults, especially women, around age 65. After 70, however, the story changes. If you have already had a DEXA scan and have started treatment for low bone density, repeating the test every year or too often does more harm than good. That is not an opinion. It is based on data from a study published in the New England Journal of Medicine. Researchers followed older women receiving osteoporosis treatment and found that frequent scanning did not change outcomes. The women taking medications like Fosamax or Actonol showed stable bone density for years, whether they were scanned regularly or not. So, why do so many doctors still order yearly scans? The reasons often come down to habit, fear, and defensive medicine. The truth is that bone loss happens very slowly. It often takes 5 years or more to detect significant changes, especially when treatment is already underway. Frequent scans can cause confusion as small, natural changes in bone density can trigger false alarms. These can lead to unnecessary medication adjustments, additional tests, and stress about something that is not actually getting worse. Instead of yearly scans, many specialists now recommend waiting 3 to 5 years between tests, unless you have had a fracture, a major health event, or have stopped treatment. To get the most benefit from bone health management, focus on the actual treatment plan, which includes consistent medication, daily movement, balance exercises, vitamin D and calcium intake, and minimizing fall risks at home. These actions do far more to prevent fractures than obsessing over test results every year. So, unless your doctor has a specific new reason to recheck your bone density right now, ask whether it is really necessary. If you have been stable for years, you might be better off without it. Now, let us move to another test that seems harmless, but can create dangerous outcomes when performed without symptoms. The carotid artery ultrasound for individuals with no stroke symptoms. This test sounds helpful. After all, the carotid arteries send blood to your brain, and if they are blocked, a stroke could happen. So why wouldn't you want to check them? Here is why. In people over 70 who have never had stroke symptoms like dizziness, numbness, or speech changes, routine carotid screening often leads to something far more dangerous than the original risk. The test itself is a simple ultrasound of your neck. However, when even minor narrowing is found, doctors often suggest a surgery called a carotid endarterectomy, which is meant to clean the artery. The problem is that the surgery can cause the very thing it is trying to prevent: a stroke. A study in JAMA found that carotid screening in asymptomatic patients led to unnecessary surgeries in over 80% of cases. The surgery caused complications, including stroke or death, in 4% to 7% of patients. This means for every 100 surgeries performed, up to 7 healthy seniors were left in worse shape than before the test. The U.S. Preventive Services Task Force, the American Heart Association, and the American College of Physicians all agree that if you are not showing stroke symptoms, this test should not be done as a routine check. Still, it happens, especially during free screening events or annual wellness visits. The scary part is not the scan itself, but the snowball effect that follows. A mild narrowing leads to panic. That panic leads to surgery, and that surgery might harm you more than the blockage ever would have. If your doctor brings up a carotid ultrasound and you have never had a TA, which is a mini stroke, a stroke, or clear symptoms, ask why. Ask what they would do if they found a narrowing. If the answer is surgery without symptoms, you should walk away from the test. Instead, reduce your actual stroke risk by focusing on the basics: keeping your blood pressure stable, managing your cholesterol, quitting smoking, moving your body daily, and staying hydrated. These changes lower stroke risk far more effectively and with zero side effects. Next is a simple blood test that sounds helpful, but may lead to painful, unnecessary procedures for a cancer that often does not need treatment at all. Number 3 is the PSA test for prostate cancer in asymptomatic men over 70. The PSA test is a blood test that checks for levels of a protein called prostate-specific antigen. High levels can indicate prostate cancer, but here's the critical truth that most older men are never told. Not all prostate cancers need to be found. In fact, most grow so slowly that they will never affect your lifespan. But once they are found, they are treated anyway, sometimes aggressively, and that is when the real trouble starts. A major review published in the New England Journal of Medicine looked at men over 65 and found that PSA screening reduced prostate cancer deaths by just 1 case per 1,000 men screened. However, it caused overdiagnosis in 30% to 50% of cases and led to invasive biopsies, surgeries, radiation, and hormone treatments that left many with long-term side effects, like incontinence and sexual dysfunction. In older men over 70, the math gets worse. A separate study from the U.S. Preventive Services Task Force concluded that routine PSA screening for men above 70 provides no clear mortality benefit and leads to a higher rate of harm than help. Yet many doctors still offer the test every year. If you are having symptoms like trouble urinating, pelvic pain, or blood in your urine, that is a different situation. But if you feel fine, the test might start a medical cascade you do not want or need. The PSA test can also give false positives that lead to biopsies, which are painful, risky, and often detect low-grade cancers that should just be monitored, not removed. If your doctor offers a PSA test at your next visit and you are over 70 with no symptoms, ask, "How will this change my treatment?" If they do not have a clear answer, you have every right to decline. The better plan is to stay informed. Track how you feel, focus on your urinary health, and talk to your provider if symptoms appear. Do not go fishing for a cancer that may never hurt you and might only cause harm if you treat it unnecessarily. Let's move to checkup number 2, a test that is part of almost every wellness visit yet can send you down a rabbit hole of anxiety and risky follow-ups: electrocardiograms, or EKGs, and cardiac stress tests without symptoms. Let's be honest, heart disease is scary. It is the leading cause of death in older adults, so it makes sense that many seniors want to be extra cautious. That is why so many people over 70 are still getting routine EKGs or stress tests at every checkup. But here is the catch. If you are not showing symptoms, these tests might actually hurt you. An EKG looks at your heart's electrical signals, while a stress test checks how your heart performs under pressure, usually on a treadmill or with medication. It sounds smart, right? But in seniors without chest pain, shortness of breath, dizziness, or fatigue, these tests often pick up minor irregularities that mean nothing. The problem is that doctors do not always treat them as insignificant. A large study published in the journal Archives of Internal Medicine showed that asymptomatic seniors who got routine EKGs were 39% more likely to undergo invasive procedures like cardiac catheterizations, despite not having actual heart disease. In many cases, those procedures led to unnecessary stent placements, new medications, or hospital stays, and none of it improved survival. The American College of Cardiology and the Choosing Wisely campaign both advise against routine cardiac testing in seniors without symptoms. But the practice continues largely out of habit. The medical system is trained to look for problems. The issue is that when you are over 70, many small changes in your EKG are completely normal. They are part of aging. But if those findings are treated like warning signs, you can end up on a table undergoing procedures you never needed. And as for the stress test, it sounds like it is checking how strong your heart is, but the real risk is what comes next. If anything abnormal shows up, even if you feel totally fine, you might be sent for a dye test, a catheter, or worse. Some seniors have had heart surgeries following routine tests, only to realize later that the blockages did not need fixing. If you are not experiencing symptoms and your blood pressure and cholesterol are well managed, you likely do not need these tests. Focus on what keeps your heart strong without the risk, such as walking every day, maintaining a healthy weight, eating whole foods, and staying hydrated. That is where prevention truly lives. Not in an EKG machine that lights up because you are 73 instead of 43. So, if your doctor recommends an EKG just to be safe, ask, "Do I have symptoms that suggest a problem?" If the answer is no, you are allowed to skip it. Safety means avoiding harm, not hunting for ghosts. Now, we are heading into the most dangerous checkup on this entire list: This one leads to overdiagnosis in more than half of all cases and triggers treatments that can rob seniors of their energy, peace of mind, and quality of life. Number 1 is mammograms and pap smears after age 75 without symptoms or risk factors. This one hits hard because it is emotional. We have all been told that cancer screenings save lives, and that is true when used at the right time for the right person. But here is what very few older women know. After age 75, continuing with routine mammograms or pap smears may do more harm than good. Let's start with mammograms. Breast cancer screening has been a major tool in early detection, but the way breast cancer behaves in older women is often very different. It is usually slower growing, less aggressive, and very often does not spread. But once it is found on a scan, whether it needs treatment or not, it is treated anyway with surgery, radiation, or chemotherapy, all for something that might never have caused harm. A large study published in Annals of Internal Medicine found that for women over 75, more than 60% of mammogram-detected cancers were overdiagnosed. That means those cancers would not have grown, spread, or affected their lifespan. Yet, most of those women still received invasive treatment, often with long-term effects on their energy, cognition, and physical health. Now, let's consider pap smears, which detect cervical cancer. For women who have had normal pap results for years and have no history of human papillomavirus or high-risk behaviors, cervical cancer is extremely rare past the age of 70. The U.S. Preventive Services Task Force clearly states that routine pap tests should stop at 65, yet many women are still getting them at 75 or even 80. False positives from these tests often lead to biopsies, infections, bleeding, and even surgeries, all in pursuit of cancers that may never develop or do damage. It is a painful truth. Cancer screening is not always harmless. After 75, for women with no symptoms and no risk factors, the risks of screening outweigh the benefits. That does not mean you should ignore your body. If you feel a lump, have unusual bleeding, or experience new pain, get checked immediately. But screening for the sake of screening is where the danger lies. Ask your doctor, do I still need this test based on my history and my age? If they say yes, they should be able to explain why. If they cannot, it is time to step back and choose caution over routine. But wait, this does not mean you should skip every checkup. Some tests save lives, some catch silent killers early, and some are backed by decades of research showing they do help seniors live longer, feel stronger, and avoid devastating surprises. So, before you throw away your appointment card, here are 3 essential checkups you should absolutely continue after 70, especially if you want to age independently, safely, and confidently. Number 3 is blood pressure monitoring, both at home and in the clinic. This is one of the simplest and most powerful tests you can do regularly. High blood pressure is called the silent killer for a reason. It usually has no symptoms, but left unchecked, it can quietly damage your heart, kidneys, brain, and eyes. According to the American Heart Association, even modestly elevated blood pressure in older adults significantly increases the risk of heart attack, stroke, and cognitive decline. The good news is that catching it early changes everything. Blood pressure monitoring does not require fancy machines or invasive tests. A home cuff and a few readings a week can give you more insight than most one-time checkups. Studies show that home blood pressure monitoring leads to better control, fewer medication errors, and a dramatic drop in stroke risk. If your numbers start creeping above 130/80ths, talk to your doctor. Adjusting your diet, salt intake, hydration, and exercise can often bring them down without drugs. But if medication is needed, catching it early means starting with a low dose and increasing it slowly to minimize side effects. So yes, check your blood pressure. It is quick, easy, and possibly life-saving. Number 2 is having vision and hearing exams every 1 to 2 years. These do not just help you see and hear better, they keep you safe. A 2021 study in JAMA Ophthalmology found that seniors with untreated vision loss had nearly double the risk of falls and fractures. And what about hearing loss? It is now directly linked to faster cognitive decline, memory loss, and even depression. That is not a scare tactic. This information is published in The Lancet and endorsed by the World Health Organization. Routine eye and hearing exams help you catch problems before they spiral. Conditions like cataracts, macular degeneration, glaucoma, and age-related hearing loss do not always show symptoms at first. But catching them early provides options, such as better lighting, contrast-enhancing lenses, or simple hearing aids that keep you connected. And here is something most seniors do not realize. Vision and hearing loss can mimic dementia. Many people are misdiagnosed, when in fact, their brain is fine. Their senses simply need support. So, get your eyes and ears checked every 1 to 2 years. It is not vanity, it is protection for your independence. Number 1 is colon cancer screening, but only with a FIT test or a colonoscopy at the right time. Colorectal cancer is the second leading cause of cancer deaths in older adults, but it is also one of the most preventable. The key is how you screen. For most seniors over 70, if you have never had a colonoscopy or if it has been more than 10 years, it might still be worthwhile. But only if your overall health is good enough to benefit from early detection. For those over 75, especially with other health conditions, the better option is the FIT test. This is a non-invasive at-home stool test that checks for blood in your stool. It is easy, painless, and has been shown to catch over 70% of early-stage cancers when used yearly. The U.S. Preventive Services Task Force supports this approach and emphasizes shared decision-making. That means you and your doctor decide together based on your history, life expectancy, and current health. Whether screening still makes sense, this involves no pressure and no unnecessary procedures. Just smart, targeted prevention. If caught early, colorectal cancer is more than 90% curable. So, do not skip this one. Just choose the safest, smartest method for your age and condition. Not all checkups are bad, and not all screenings are helpful. The key is knowing the difference. Be your own advocate. Ask questions and make every test count. And remember, the best care is not about doing more. It is about doing what matters most and skipping the rest. Now that we have gone through all 5 tests, here is the truth. More checkups do not always mean better care, especially after 70. Your body changes and your risks shift, but the medical system often keeps pushing outdated routines, and those routines are leaving many older adults stressed, overtreated, and worse off than before. You are not refusing care. You are choosing smarter care that protects your quality of life, not just your numbers. Every unnecessary test comes with a cost, including fear, time, and recovery from treatments you may never have needed. Studies from JAMA and the BMJ show it clearly. Many seniors suffer more from what is done to them than from any illness. This is not about fear, it is about power. Armed with the knowledge of which tests matter and which to skip, you can start asking better questions. Why this test? What happens if we find something? Will treatment help me feel better or just make me sicker? If a test leads to better care, go for it. If not, you are allowed to say no. Aging well means staying in control, choosing peace over panic, and living on your terms. So, the next time you hear the words routine screening, remember this information and speak up. If you have any questions or comments, please feel free to leave them below. Thanks for watching.